Thanks for the invitation. So I'm at the last minute. I had to present on behalf of Dr. Gray. Unfortunately, she's not able to make it to the meeting. So I'm Shivaramu Keelara, working as research assistant professor with Dr. Paula Gray in the Department of Population Health and Pathobiology. And I have a DVM degree from India and a master's in public health, veterinary public health. And I came to US to NC State for my PhD, which is more focused on One Health approach, looking at Salmonella dynamics in pigs with antibiotics, pigs without antibiotics, and the humans in North Carolina. So my research, and it's focused mainly on like One Health approach, looking at the dynamics of foodborne pathogens, antimicrobial resistance in humans, animals, and the environment. Why I'm stressing environment here is my talk is more concentrated on the environment. Many researchers, we ignore the role of environment. We always blame each other, human medicine, the veterinary medicine. So probably my talk is more like it is shorter and more towards the environment. So we know that like the bacteria and the viruses, they inhabited the earth before us. The man and the humans, they're lost into in the game. So they re-entered recently. These bacteria, they survived for billions of years in the earth, and they evolved, and also they developed survival mechanisms against different things, like including antimicrobial resistance. And also, I recently read the report in 2012. There was a report documented that there was a antimicrobial resistance reported in a bacteria which was like 4 million year old bacteria, like before the existence of us. And also, Dr. Moll shows that there was one bacteria in the mountains. It's encountered resistance to the newer generation of drugs, that modern day drugs. They were here before us, and they're fighting constantly. So what we are missing here is the important piece of the puzzle, that is environment. As I said, we always blame each other for the misuse of antibiotics in both sector, human sector and also in the veterinary medicine. But we need to focus on environment too, which is playing a major role in dissemination and occurrence of antimicrobial resistant genes over a long period of time. So this is the curve, the capacity curve of the environment, where when there is a unlimited resources available, the population grows exponentially. But when there is a environmental factor in, when there is a limited sources available, the population grows in a logistic way. So the bacteria were here before they survived the dinosaurs. Definitely, I hope they will survive us too. And they will fight every day in coming up with newer mechanisms to fight the limited resources. They will compete with us for the limited resources, and they will evolve. And this is the timeline of the antibiotics timeline, where the origin of antibiotics. If you look at the timeline after 2000, maybe only 15 antibiotics, the newer generation, new antibiotics has been discovered. So, despite of irrespective of use of whoever uses the antibiotics for what they are using, ultimately they'll end up in the environment. That's why we need to focus on the environmental as a key factor in this puzzle. Oh yeah. Yeah, why I'm stressing on the environment is there is always a chance for the environment to reset itself. Like for an example, deforestation. So this is the this is the island, Borneo. It's shared between Malaysia and Indonesia. So what they did is they started cutting the forest for palm oil plantations, and they started noticing outbreak of malaria and dengue fever in a exponential way. So we are contributing by altering the environment. When there is a disturb in the environment, it automatically resets itself in terms of bacteria, in terms of resistance, everything. So every day, like routinely, we are exposed to many things. This is like a busy slide where it is human, animal, and the environment. They're interlinked each other to the different variable factors. We often we are exposed to like many factors, including like we eat vegetables, like we travel globally, and bacteria doesn't have any border, international border or anything. They can travel with us. So the domestic travel, the climate change, the weather change, the migratory birds, they don't have any border to transport the whatever they have in their gut microbiota. So the factors, they're interlinked with the humans and animals every day. So this gives us unique opportunities to study the environment. As I said, environment, whenever we disturb the environment or when there's a natural calamities, the environment will reset automatically. So this will give us an opportunity to study the AMR, especially when there's hurricane, floods, drought, fire, and there's volcanic eruptions. So it washes away, the flood washes away the topsoil, and it will replace us with a different soil from our water from different area. So what we did is North Carolina is exposed in the previously it's exposed to many flooding due to a lot of hurricanes. But this time we started focusing on Hurricane Florence, which hit North Carolina in September 2018, resulted in significant economic loss in terms of animal production. It is estimated that around 3.4 million poultry and more than 5,000 hogs they destroyed due to flooding. So because of flooding, it also resulted in overflow of sewage both from animal farms and also the human waste across the cities, resulted in contamination of soil and water bodies. So these are the pictures from Florence hurricane, which destroyed North Carolina. So we selected a few photos from the Florence hurricane. This is a residential recreational park where the newborn Union Point Park, and this is the residential area, and the Neuse River which flows all the way towards the Union Point Park, and the arc forms, they are completely flooded with hurricane water. So what we did is, so we came up with a plan. So this is the best time to study the role of environment, whether it has been reset and what's going on in the environment. And we wanted to continue this study at least for a year in anticipation that we may see one more hurricane. Like it's hurricane season usually between in September and October, and we may see some hurricane. So we are lucky we didn't see a big hurricane, but we had heavy rainfall in North Carolina during September. So we selected 6 sites along the Neuse River basin, which we focused both on human and animal involvement. So that's why we selected. One is the poultry production area, and the second one is Neuse River itself, and then third is the residential area where I showed the photograph in the previous slide where it was flooded. And the fourth one is the swine farms. This area is like Kingston area. They have a lot of swine farms in and around. They were flooded with Florence hurricane. And the fifth one is human hospital in the newborn area. And sixth is Union Point Park. It's a recreational area. It was completely submerged with the Florence hurricane water. So we started collecting soil samples and water samples wherever the creek is available, like in the site 1 and the News River 2 and residential area. We didn't find any like creek near for the swine farms and also near the hospital. So we didn't collect any water from these 2 sites. What we did is we tested them, like we analyzed for the isolation of like E. coli, generic E. coli, and then ESBL E. coli, and Salmonella and Enterococcus. So these are the results from the study. This represents around 11 months data, and this is per site data, how different they are in for Salmonella. We found a total out of 660 or 770 samples. We found like 59 samples were positive for Salmonella, and you can see like how they distribute among the different sites. Here the highest was found in the like near to the swine production area. So we found like 8 isolates, and also the site 2. This higher number is 27 is from the last month. So from last month it was like around 10 samples were positive in the News River Basin, but in the last month I found like out of 70 samples, 17 samples were positive for Salmonella. I'm really like amazed. I'm going through those samples like the serotype, like for characterizing those Salmonella. I want to see like what's going on with that site in September. And Enterococcus, and it's there in the soil, we found like 90 to 100% prevalence of Enterococcus. Generic E. coli, we found more like prevalence in the last site where the Union Point Park. This is a recreational park. Whenever we go for sample collection, we see a lot of kids playing in this recreational area, and also I see a lot of geese and pigeons and other birds. They're feeding on the shore. And we also found ESBL E. coli. These are we selected this ESBL E. coli by just adding the cefotaxime to the McConkey agar. That's 4 microgram per ml concentration. We selected those grow on the McConkey with cefotaxime, and we further confirm with a distribution test for the ESBL, and we do the whole genome sequencing and some CTXM genes by PCR. So this is the graph which shows monthly distribution of Salmonella, E. coli, and Enterococcus. Why I'm showing this one is like after the hurricane, we started sampling. It's happened in September, and we started in October sampling in the mid of the October, and we continued till this September. You can see like in the beginning, Enterococcus prevalence went up and it started declining, and as soon as the June, July months comes, again it's in the increasing trend. So if you focus like Enterococcus, it's a normal gut microbiota, it will be there. But if you focus on the Salmonella, it was in the decreasing trend until June. Now it is in the increasing trend in the rainy seasons in these areas. So, and this is in the water samples. Again, it followed the same trend here and there, like a few exceptions. The Salmonella, it was like in the increasing trend in the beginning when there was like Florence hurricane in the November and December. Then it started declining. We didn't find any Salmonella in water from January to May. Then it started again increasing in the water samples too. So this is like ongoing project. So still we are characterizing these isolates, and also saved the soil samples, and I'm looking for some funding agency to characterize them, like for our looking at the microbiome diversity with those soil samples. And what we did is we selected a few isolates in the beginning to see for their antimicrobial susceptibility profile. So we used NAMS prescribed that NAMS plates, and that's a Trek diagnostic plates. So we looked at the panel of 15 to 18 antimicrobials, and this is the ESBL isolates. You can see they are resistant to 3rd generation beta-lactams, including ceftriaxone and ceftriaxone. So, but we didn't find much resistance in Enterococcus and generic E. coli. So we mainly focused on ESBL E. coli as they are resistant to third generation cephalosporins. And this is the multi-drug resistance profile which we identified from ESBL E. coli. They were resistant to more than 12 antimicrobials. These are the isolates which are isolated from soil and water samples. These are not directly collected from animals or the humans or anything. These are in the environment. And we also found similar resistance pattern in different months. This in December, January, February from recreational park and the vicinity next to the human hospital. We don't know the direction of the transfer of horizontal genes. Definitely we are going to do some whole genome sequencing, and we look into like phylogenetic tree from where they are originating, whether it's from human or the environment or from the animals. We're going to do some deep studies into these isolates. We select the isolates which are like have a unique pattern that is similar pattern among all the three areas. In contrast with the Salmonella, we tested only 12 isolates out of 180 isolates. We found resistant to only 4, that is, it was resistant only to streptomycin. Good that it's only like it's not multi-drug resistant or anything, but we have more isolates to characterize. I'm really interested in looking at like selecting isolates, Salmonella isolates from each month and get the serotype done. And I want to see like is there any change in the serotype over the period of time. Since we are sampling at the same place over like every month for a year, we should get an idea what's going on in the environment for a period of year. To summarize, we know that like this ongoing study, and we try to like define the role of environment in transmission and occurrence of these resistant pathogens. This like the natural calamities will give us an opportunity to examine the environment, reset. And as I said earlier, we always like ignore the factor of environment in the role of transmission and dissemination. And I know it's complex link between human and animals, but we need to stress on the environmental role too. And thank you.